Hello, I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Well, whether you're standing, walking, or running, your feet are bearing the brunt of your body every day. Our guest today is Dr. Luke Madsen. He is a Mayo Clinic Health System podiatrist. Thanks for joining us today, Dr. Madsen.
Thank you. Thanks for having me here today.
Well, we are talking today about healthy feet and foot care. So let's start out with the basics. First of all, as a podiatrist, the feet are your specialty, correct?
That is correct. As a podiatrist, I went to school focusing on the pathology of the foot and ankle. We go through extensive training to become a specialized physician that diagnoses and treats the ailments involved with the foot, ankle, and associated structures of the leg. In general, after a bachelor's degree, we go through a 4-year medical school and then go on to a 3-year surgical residency thereafter. We specialize in different types of foot and ankle surgeries involving diabetic limb salvage, reconstructive flat foot. We do a lot of forefoot correction with bunions and hammer toes. The most rewarding aspect of my profession is to help my patients walk with less pain or disability with surgery and or clinical methods. I know myself, as well as many of my listeners, have had pain in their feet at some point in time. Often feet are the farthest things from people's minds, but healthy feet play a fundamental role in the quality of our lives. Also, I see a lot of patients that have associated knee, hip, and back pain that stems from their foot conditions. Around 75% of Americans will experience foot pain in some part of their life, and overall, a podiatrist like myself is the number one doctor to go to for your feet.
So when should someone see a podiatrist like yourself?
On a common day-to-day basis, I see patients with a lot of structural and biomechanical deformities. I see patients with high arch feet, people with low arch feet, people with bunion deformities and or hammer toes. Many of them deformities are either stem from a biomechanical imbalance in their feet when they're walking improperly, or they develop some sort of acquired deformity due to many different factors with shoe gear. A diabetic patient is a special category of patients that should be seen by a podiatrist regularly. There are several issues that affect their feet, such as loss of protective sensation, deformity. They develop wounds, they can develop infections, and people that have a high blood sugar aren't able to heal the wounds effectively. Also, I see patients with peripheral vascular disease and circulation problems in their feet.
So let's start out with the basic foot pain. Do you see a common cause in most cases? And I'm guessing it's probably footwear, shoes.
A lot of people come to me with a lot of different foot pain, and they will present with shoes that are malfitting, that they're worn out, they're not, that they should have been replaced a long time ago. Also, a main cause of foot pain in my patients is a structural malalignment of their feet and or combined with their foot structure. A lot of people will have flat feet, they'll have high arch feet, they'll have bunions and hammer toes, and then that stems from either a biomechanical deformity, that led to that condition, or shoe wear that they are not appropriately fitting their feet in.
So let's start with kids, because obviously kids' feet grow. When it comes to kids' footwear, I'm assuming that can often cause foot problems with children is because their feet or their shoes are too small.
Yep, that's correct. That's one thing I always tell my parents that come to see me is that you want to always adjust their shoe gear to make sure that they have enough room to grow in. Because, children now, they rapidly grow so fast that they should always, replace their shoes often, especially if they're getting tight. Also, they should buy a shoe that has a firm supportive heel, that has a supportive insert and a cushion to it. In general, I use a rule of thumb of using the width of your thumb, which is about a half an inch, between the end of the toe, big toe, and the shoe should be appropriate when a person's standing up, to have that much room in your shoe. Also, it's important if they have any underlying biomechanical deformity like a flat foot or high arch foot, that we accommodate that with an orthotic, that when they're walking, that this will help stabilize that foot and prevent any future complications with pain or deformity.
How about adults? And let's start with women, because women oftentimes wear, high heels, a lot of shoes that probably your feet aren't made, to be at a certain angle or a certain pushed into a certain area. So talk about women's footwear.
Well, women's footwear, I find a lot of women that wear high heels for a prolonged period of time do have a lot of deformity, such as hammer toes and bunions. They'll have heel pain, and they can eventually develop contracture of the back of the ankle. And all this is, over a prolonged period of time can lead to severe problems and even surgery. I usually tell my female patients that want to wear a dressier, higher heel shoe to just wear it on occasion. You don't have to wear it all the time. And for the most part, you should be wearing a flatter shoe that has more of a supportive insert and has ideally would be a lace-up shoe that can accommodate the foot rather than pushing it too tight into a smaller shoe.
How about men?
Men, depending on their occupation, I always recommend that a male wears an Oxford-type shoe that has a lace-up. If they're working in industry that they're around heavy objects or they're in a factory, I always recommend that men wear a steel-toe boot or a steel-toe shoe to protect their feet from anything that may fall on them.
And how about general buying tips when you're looking at purchasing footwear? What are some tips?
Well, some tips that I tell my patients, always go to a real shoe store that has someone that's professionally trained to measure your foot up and can make recommendations based on the width of your foot. It's very important that that you go and you try both the shoes on, that you go around, walk around the store, and that you can fit a thumb length between the end of your big toe and your end of your shoe. Also, it's important to get shoes towards the end of the day when your feet have been swollen a little bit more so that you can accommodate any swelling that your feet may have. And I always say to patients, don't rely on the last shoe size that you had. Each shoe is a bit different and your feet can change, so you should get that measured. I also tell women that if they've had babies, each pregnancy can cause your foot to increase in length about a half a size, because the hormones in the body that prepares the women for birth will actually drop the arch of the foot a little bit and increase it about a half a size per child. So overall, number one thing I'd say to my patients who are going to get shoes, buy appropriate shoe wear, go to a store that has a professional that can measure your foot up and make recommendations for you.
You mentioned earlier orthotics. So what are orthotics? Are they special shoes that you wear, or are they inserts that go in the shoes, or are they both, or what are they?
Well, orthotics are special inserts that go into your shoe that correct the abnormal walking patterns caused by either a biomechanical deformity or a structural deformity with your foot. There's different types of orthotics. There's a custom orthotic that's casted to a patient's foot with their foot in a neutral position that will help accommodate any biomechanical deformity their foot may lead to have or tend to have. And the other kind of orthotic is accommodative orthotic. Usually I prescribe them for my diabetic patients or patients with a bony deformity to kind of bring the ground up to their foot and to help offload the balance, offload the pressure on the bottom of their foot to prevent any reulceration or abnormal pressure being placed. Also, we can do over-the-counter orthotics. Those do help support the arches and can help several ailments that I see with biomechanical abnormalities.
Let's talk about some of the common foot problems that you see patients for. Let's start with bunions. What exactly is a bunion?
A lot of people have a misperception of a bunion. They think it's a bony callus off of their big toe joint, which in fact, bunions are very complex. They are usually a structural abnormality, an imbalance of your foot, leading to your big toe joint moving up and out, causing a bony prominence over that area. Also, it'll affect the big toe by pushing it over, and most people with a bunion deformity lose that ability to push off inside of their foot, leading to other deformities and pain. They can lead to calluses, they can lead to metatarsalgia and or hammer toe deformities.
And what is it caused by? What are bunions? Do they just show up, or is it bad shoes, or
Well,
or
there's a
what?
variety of different causes for a bunion. I mean, one is a biomechanical cause that your foot tends to have, or some people tend to have, like some people with a flatter foot, they lose the muscle and stability of the big toe joint, and over time their first MP joint will lift up and lose stability. When they push off, they'll develop arthritis around that joint, and the big toe will kind of shift out and won't stabilize their ground when they're walking so much, and that will push the other toes over. The hammer toes will come up, and they'll end up having more pressure under other parts of their forefoot region that's not normally there.
Now, you talked about hammer toes. What are hammer toes?
Well, hammer toes is a contracture of the digits, and it's caused by imbalance of the muscles in the legs and the feet. When you think about the lower extremity, there's muscles in the foot and in the leg that help stabilize the toes. So with the muscles on top of the feet and on the bottom of the feet, as well as in the front and the back of the leg, they all stabilize the toes to the ground when you're walking. When someone has a biomechanical deformity like a flat foot or a high arch foot, they will have muscles that fire longer than they should, and they'll overpower the digits, causing a contracture of the digits. If we catch these in time, we can treat them with an orthotic and they'll be flexible. However, if someone lets them go too long, there'll be a structural deformity and lead to pain. In certain patients that are younger, we do surgical correction to recorrect their toes. If they're an older patient, we usually do offloading pads or accommodations to prevent pain.
All right, let's talk about heel pain. One of the things that you hear often about is plantar fasciitis. Talk a little bit about what that is.
Well, plantar fasciitis is one of the most common ailments that I see come in my clinic. Plantar fasciitis is the inflammation of a thick ligamentous band of tissue that attaches to your heel and it spans across your arch into the ball of your foot. People with plantar fasciitis tend to have either a lower arch foot or a higher arch foot that led to that complication, or they have a rapid increase of activity or something leading to that thick band of tissue becoming inflamed. Those patients, they present with pain in the first step in the morning, they present with pain after getting up from a resting position, and they describe it more of like a burning, stabbing pain in their heel. Those types of patients, I recommend orthotics, and there's various different types of clinical and or surgical treatments to help correct that and help resolve their pain and issues.
Now, you mentioned earlier that you see a lot of diabetic patients. I know diabetes, that disease plays a large role in a podiatrist's practice. Talk about how you help diabetics.
The number one thing to think about with diabetics is, what's the cause of their problem? Most of the times in my field, in the feet, I see high blood sugars tend to give off a toxic byproduct that affects your nerves. And that's how I describe it to my patients. And the longest nerves are affected, the first from that go all the way down to the end of your feet. And generally, the biggest problem is that patients that have high blood sugars over a prolonged period of time lose the sensation of pain to their feet. Usually starts in a stocking glove type pattern around the toes, and it can work its way back depending on if they get their blood sugars under control soon enough or other different factors. A lot of times if you and me would have something in our shoe like a pebble, a needle for instance, or something that shouldn't be there, we would obviously know to take their shoe off to get that out of the shoe. People with this peripheral neuropathy from the diabetes, they don't have that ability. So they will keep walking on that area of their foot, they'll break down into a thick ulceration and they can get infected. So that's one major complication I see with diabetics. Another thing is the neuropathy, the loss of nerve sensation in the feet, will cause an imbalance of the toes, and it will cause to a structural deformity with the hammer toes, which will put abnormal pressures against the shoe when they're walking. That leads to sores. Again, we're dealing with an ulcer that can get infected and needs surgery. Also, people with diabetics have neuropathy involving their autonomic nerves, so they won't produce sweat as they normally should. So they get dry, cracked skin. We have to make sure that they lotion it regularly. That opens another avenue of infection. In general, in diabetics, I tell them if you have a blood sugar over 140, you're not fighting off a bacteria normally like you should, because high blood sugars actually inhibit your own immune cells from fighting off bacteria.
All right, so we're just about out of time, but any last-minute words of advice for folks to keep their feet healthy?
The major thing to keep people's feet healthy, I would say, is always wear appropriate fitting shoes. Go to a professional at a shoe store, get your feet fitted up, and wear shoes appropriate to what you're doing. Like if people are out running, walking, exercising, wear an athletic shoe. If people are working in an industry where they can have a heavy object fall on their feet and they're at risk of having an injury that way, they should wear a steel toe shoe. And people should see a podiatrist like myself to correct any biomechanical deformity that they would have in their feet. And if you have pain that starts, go get it checked out before it gets too late.
Great. Well, unfortunately, we're all out of time, but I'd like to thank our guest today, Dr. Luke Madsen, podiatrist with Mayo Clinic Health System. Thank you very much.
Thank you.
Have a great day, everyone, and be healthy.